31,000 years ago, inside Liang Tebo Cave in Borneo, the lower left leg of a child was surgically amputated. The skeletal remains are consistent with deliberate surgery, not animal trauma or an accidental fracture. Since the bone remodeled into a smooth rounded stump, we know the child survived the immediate trauma. They lived for another 6 to 9 years before receiving a careful burial. This complicates the standard pop culture trope where a hairy caveman bites a stick while 3 cousins pin him to the floor. We love that cartoon. It makes us feel advanced. Sitting with ibuprofen in our pockets, we imagine prehistory as a dark corridor of simple suffering. Except the actual record keeps disagreeing. Consider a Neanderthal from El Cedron, Spain. He was managing a painful dental abscess and a chronic gut parasite, Enterocytozoon bianusi, which causes persistent diarrhea. Researchers know these details because they extracted ancient DNA from his dental plaque. Analysis of this calculus revealed genetic traces of poplar bark, a natural source of salicin, which metabolizes into salicylic acid, the active ingredient in aspirin. The plaque also showed exposure to Penicillium rubens, a mold genus that produces natural penicillin. The findings suggest possible self-medication with local resources that had pain-relieving and antimicrobial relevance, though we cannot prove exactly what the Neanderthal intended. Now compare this to 1897, when Felix Hoffmann, a chemist at Bayer, acetylated salicylic acid to make it more tolerable for the human stomach. Bayer commercialized the compound as aspirin. A global drug brand grew out of chemistry that sick hominins may have been accessing from trees tens of thousands of years earlier. Even aspirin's modern origin story is messier than the corporate version. The Penicillium DNA is equally notable. No one is claiming this Neanderthal understood the mechanics of penicillin. That would be nonsense with confidence. Alexander Fleming's 1928 discovery of penicillin was a laboratory accident. The El Cedron plaque simply shows exposure to the mold, not a controlled antibiotic practice. Yet, the overlap is uncomfortable. In 2014, the World Health Organization reported that antimicrobial resistance was a global health threat, warning of a potential post-antibiotic era where common infections could once again become fatal. A 2022 systematic analysis in The Lancet estimated that in 2019, bacterial antimicrobial resistance was associated with approximately 4.95 million deaths, with 1.27 million deaths directly caused by drug-resistant pathogens. We industrialized the solution, saved lives on a scale ancient healers could never have imagined, and then overused the miracle. Widespread clinical and agricultural misuse has trained bacteria to ignore our drugs. This overexposure is pushing parts of medicine back toward vulnerabilities our ancestors would have recognized. Back to the leg on Borneo. Surviving a lower limb amputation in a hot, humid tropical environment 31,000 years ago is highly unlikely without a reliable method to manage blood loss and prevent post-surgical infection. The remodeling of the bone shows the procedure was successful. This implies the foragers possessed anatomical knowledge and provided structured aftercare. To put that survival rate into perspective, modern hospitals still struggle with the same procedure. A 2023 review in Curious found that 30-day mortality after lower extremity amputation averages 16.45%, with some studies reporting rates as high as 51.4%. Of course, this comparison needs a warning label. Modern amputees are often elderly, diabetic, or dealing with severe vascular disease. The Borneo child was a youth with localized trauma. Even with that caveat, the survival matters. A foraging group in Paleolithic Asia successfully managed a procedure that remains a major clinical challenge today. Trepanation opening a hole in the skull of a living person is documented globally in the archaeological record. A 2018 study by Kushner, Verano, and Teitelbaum analyzed over 800 trepanned skulls from Peru, demonstrating that survival rates improved over time. Around 400 BCE, patient survival was approximately 40%. By the late intermediate period, between 1000 and 1400 CA, survival reached 91% in specific regional samples. Under the Inca Empire in the 15th century, the average survival rate stabilized between 75% and 83%. For a comparison nobody asked for, look at the American Civil War. Civil War surgeons had metal scalpel sets, chloroform, and formal medical degrees. Yet, when they performed cranial surgeries, they lost between 46% and 56% of their patients. The study suggests their technique improved over time. Smaller openings, more refined scraping, better avoidance of vulnerable areas, and accumulated practical knowledge. The exact infection control methods are difficult to reconstruct, but Civil War doctors failed because they routinely introduced pathogens. They operated with unwashed hands, dirty bandages, and unsterilized tools. This does not mean ancient Peruvians were better than modern neurosurgeons. It means cranial surgery has always been dangerous, and ancient practitioners were far more technically competent than the stereotype allows. Modern neurosurgery is obviously different, but it took a long time to get here. A 2024 analysis of modern craniotomies for traumatic brain injury reported a 30-day mortality rate of 20.3%. While these modern cases typically involve severe head trauma rather than simple trepanation, the data shows that cranial intervention carries inherent biological risks that both ancient and modern practitioners had to manage. Beyond physical treatments, social support played a measurable role in prehistoric survival. This is illustrated by Shanidar 1, a Neanderthal fossil found in Iraq. The skeletal remains indicate a catalog of healed injuries: a fracture to the left orbit that likely caused partial blindness, a severely withered right arm partially missing below the elbow, and degenerative joint disease in the lower limbs causing a permanent limp. A 2017 skeletal analysis also identified external auditory exostoses, bony growths, in both ear canals, which would have caused conductive hearing loss. In a Pleistocene environment filled with apex predators, a deaf, half-blind Neanderthal who could not run was not exactly built for solo survival. Nonetheless, osteological analysis indicates he survived to an estimated age of 35 to 50 years. His survival suggests that his social group likely provided food, protection, or other forms of daily assistance, compensating for his physical limitations. Now look at the modern version of our species. A 2023 advisory from the U.S. Surgeon General warned that social isolation among modern humans carries a mortality risk comparable to smoking 15 cigarettes a day. According to the U.S. Census Bureau, single-person households made up over 27.6% of all American homes in 2020, compared to just 7.7% in 1940. We have traded physical community for central heating, delivery apps, and digital screens. Solitary existence is easier than ever, allowing us to avoid our neighbors while our mental and physical health silently deteriorates because no one is required to notice. A disabled Neanderthal survived for decades because his group stayed close enough to act as his support network. By contrast, modern urbanites can die in high-rise apartments and remain unnoticed for weeks. That is the awkward split. We got better at chemistry and worse at noticing each other. The CDC reported approximately 81,000 opioid overdose deaths in the United States in 2023. Although the factors driving the opioid crisis are complex, it underscores the limitations of relying solely on chemical pain management in the absence of stable social support. Prehistoric populations managed pain through environmental observation, botanical treatments, and collective care, demonstrating that survival was a cooperative effort. After all the pills, scalpels, surgical robots, and apps that remind us to breathe, the oldest painkiller is still the one modern life keeps making optional: other people.